Services Committee. If we have any veterans in the audience or anyone listening, I'd like to wish you happy Veterans Day and thank you for your service. First thing is the approval of the agenda. We have a motion to approve and support. All in favor? Aye. Next up on the agenda, we have public comments. Is there anyone that would like to address the board for a 5-minute opportunity? All right, moving on, we have the minutes of the October 7th meeting. We have a motion in support to accept those meeting minutes. All in favor say aye. Aye. All opposed? Motion passed. We have the Lifeways monthly report. Ms. Mary Beth?
Good morning, Commissioners, on this cold day. For this month's report, I did send that out to you, so you should have gotten that in advance. Want to give an update related to the activities that we are jointly working on with the counties. It has been a month now. A lot of the bumps have been worked out, I believe, related to the transition for the support for the building maintenance support and housekeeping at Lifeways. And it has been going well. People have commented positively on the staff from the county there, so people are very happy. The other thing that's happening is related to the transition of the Hillsdale County building that has now transitioned over to the management of Hillsdale County. And we are also in the process of looking at the potential. Right now we lease some storage space, and we are also looking at leasing some potential space from the counties as a possible support. And then the other thing that I wanted to give an update was related to regionalization of the PIHP. I don't know how many of you know Nancy Miller. Do any of you know Nancy Miller, a former CEO at Lifeways? She has taken on the CEO position of the Mid-State region that we are now a part of, the 21 county, 12 CMH region, Mid-State Health Network. She is now in place, and we are in the process of working on the region as far as hiring the additional positions for that regional entity. There are some activities that I would like to let you know about related to the regionalization and advocacy efforts on the part of the region related to equitable access for services and equitable access to care. And with the Mid-State region, as I've talked about before, one of the challenges that we find when you bring 12 community mental healths together and all funded at different levels, one of the founding principles on which we formed this region was that there would be equity across the region, and that is an expectation of the state, actually, that there be equity as far as how the funding comes down for Medicaid. With the current structure, it does not allow necessarily for equity of funding without there being some potential winners and losers in that region. So we are working from a legislative standpoint to really advocate for the fact that there needs to be a recalculation as to how they calculate the per member per month for that region. And there is actually going to be on December 3rd a Republican caucus being pulled together that is going to look at how can we create equity within actually the entire state related to how the community mental health are funded to ensure that there is equitable access to care, because that really is what we're trying to achieve here, is to ensure that no matter where individuals go in the state of Michigan, that they will get the same level and intensity of care. We're very happy that we have the support of some of the Republicans within this region to go ahead and host that. So we are doing that. The other thing that we are doing is advocating on behalf of the local funding, because that is another area in which we know that counties, Lifeways is experiencing that with both of our counties, related to challenges that the local match obligation has to counties, and how we might be able to partner and change the code to allow for for that to be equitable again across the state related to local match obligations. So I just want to let you know that I'm continuing to have those discussions with legislators and with the department to ensure that we can do more to support our counties related to local match and keeping local dollars local. The other thing that's happening is related to the mid-state, the waiver. As you know, the Medicaid expansion, as I spoke last month, there were two key waivers that need to happen that the department has to submit for the Center for Medicaid in order for the Medicaid expansion or Healthy Michigan plan to actually go into effect, and those were submitted last week. I do anticipate, because there has been discussions all along with the Center for Medicaid in regards to the state's application for the two waivers, that it should be, I don't anticipate that they're not going to approve it. They've been a part of those discussions. The state is still planning on implementation of that beginning April 1st, so there'll be a lot of work. More information will be coming back to you related to how, as a county, we will be supporting those in Jackson County to get registered for those that will be eligible under the expansion. The last thing was I had spoke last month, and there was a question in regards to the one bill that's out there related to substance abuse, and the language in regards to taking and creating a revenue stream with the current, what's the word I'm looking for? Oh, it's like eluding me. I apologize. But anyways, for what the sales of alcohol and beverages, that they were going to take a % of the revenue earned from that and divert it towards having a focused mainstream funding for substance abuse. And last time I was here, there was some discussion and clarity needed in regards to, does that mean that they're going to be taking it from somewhere else related to that diversion of those funds? And that is not the case. I had reached out to our association, and they had indicated that this is actually specially earmarked for substance abuse services, and it's not going to be taken from anywhere else. So I just wanted to kind of bring that back. You had asked that clarity last month, and I obtained that through our association. So that is it for my report. And I apologize, I can't think of the word that, like, you know how that happens.
As soon as you sit down, it'll come to you.
Yeah, yes.
What comments or questions might you have for Mary Beth? Thank you for that information.
All right, well, thank you.
Thank you. Next on the agenda, we have Department on Aging Monthly Report. Ms. Marcy?
Good morning. Wanted to let you know that we had our second department-wide organizational, high-performance organization training the end of October, and primarily it was a follow-up from the training that we had a year before, because in the past year there's been 4 different employee groups that have met to discuss different topics that could help us improve services or improve the way we do things. So it was a report out of that. And also each group of employees explained to the entire group some of the work they do. So the meal transporters had a couple representatives speak, the kitchen staff, nutrition site leaders, home care workers, even the administration part of it. We gave a presentation. So it was very well attended. There were 71 employees there. We have a lot of casual employees. And then the aging leadership team will continue to follow up on the employee work group suggestions. Cold meal program, over a year ago, I explained that we were trying something that the Michigan Office of Service to the Aging said we could go ahead and pilot a program that we called Food with Friends. And that was where if there was a group of seniors getting together or congregating, that's the key word for the grant, that we could drop off some cold meals for them to have for lunch. And I reached out to a few groups to see if they were interested, and one group in Grass Lake did meet September until spring, and as Food with Friends. And we, again, while our meal transporter was out delivering meals, and they dropped off these cold meals. But that group stopped for the summer, and it hasn't resumed. So I just wanted to give you an update that, we tried this. It's still possible, but we tried it. It hasn't taken off, so to speak, so it's just kind of on the back burner at this point. And in the meantime, with funding cuts, we're looking at the cost for preparing cold meals. And a cold meal is like a sandwich and a salad and fruit, and it's for Meals on Wheels person to have for supper if they need it, and also the Congregate Nutrition site, if they have a hot meal, they could take this cold meal home and have it for supper or lunch the next day. But that, there is, of course, a cost to that, so the nutrition manager and I will be looking at that and seeing if we can continue that or not. So, before we had cold meals, the second meal for Meals on Wheels clients was a frozen meal. So that could be an option. And then I just have some statistics on, in a week's work time, how many people received Meals on Wheels, how many of those meals were hot and cold, that type of thing. Commissioner Mahoney? The cold meal is more labor intensive because you're putting something in the different, the 4 different sections of the meal container, whereas a hot meal, it's quicker the way they scoop it into the dishes and have it sealed, so it's just more labor intensive. Yeah. Food product wise, Lori said it's not a lot of difference, it's the time. Yeah. So good question. And I thought it was great, there was a county-wide food drive, and a lot of our employees participated and donated 500 pounds of food. So I thought that was great that the county organized that. That was nice. One thing that happened after I submitted the report, we do have staff and volunteers that help people with Medicare Part D to look at their drug plan for the coming year. And we have a limited number of appointments, and those appointments are full. We've had so many people contact us that want to come to the senior computer lab and sit down with a volunteer staff person and look through their options, but those appointments are full. So we're recommending that people go to the CMS, Center for Medicare and Medicaid Services website themselves, or there is an 800 number they can call. But we can mail a piece of information to people who would like us to do that. It gives them some tips on things they can do to make that process a little quicker. Any questions about what before I go on to the next? Okay. Is it okay if I'll go on to this? All right, the memo regarding the Lifeways Depression and Memory Screen contract. And this is an agreement we've had with Lifeways for several years where our Masters of Social Work staff, often as a first step toward additional services, either through our department or a referral to another entity, we will do a depression screen or a memory screen. Primarily it is depression screens. And then we can invoice through the Lifeway system up to $15,000 a year. So I wanted Human Services to be aware of that.
Right, and I believe I'm looking for a motion to authorize the Department on Aging, the director, to sign an annual service contract with Lifeways for up to $15,000 payment to Department on Aging for older adult memory and depression screens. Support. Motion and support, all in favor, say aye. Aye. Opposed? Motion passed.
Great, thank you.
Thank you. Any other comments or questions for Marcy? Marcy?
Okay.
All right, thank you. Next on the agenda, we have a Health Department monthly report, and I believe an introduction as well. Welcome,
Yes,
Richard.
we do. Good morning, Commissioners.
Good morning.
It's great to be here with you. It was a great Veterans Day. Thank you for the time off. I did want to take a minute to introduce Don Hayduck, our new Environmental Health Director. Don, would you come up and introduce yourself and say a few words for the board?
Thank you very much, everybody. I am now entering my second week of work here, so very quickly trying to get up to speed. I did meet my departments last week, animal shelter as well as environmental health. I did get a chance to briefly meet Mr. Overton on Friday afternoon. So I'm starting to get some names with some faces. Names are not one of my fortes, I will admit that right from the start, but I will do my best. I'm very looking forward to working with Jackson County. I come from 20 years worth of experience from Livingston County. Livingston and Jackson seems to have a a linkage there through the past several years and continuing that on. So thank you very much. I'm looking forward to working with all of you as well and learning the timeline so that we don't have any last-minute snafus or anything. Are there any questions anybody has of me?
Great. First of all, Don, welcome to Jackson County. Good to have you here, and we look forward to working with you. Any comments or questions? Excellent.
Well, thank you very much.
Well, welcome. We'll give you just a mini little brief time before we jump on board with all of our questions, right?
Appreciate it.
Thank you.
We've already had Don over at the animal shelter, so he's getting his feet wet. I will have Don come to you on a quarterly basis to give you an animal shelter quarterly update report, so I won't be trying to cover that in my report for you in the future. Anyway, just to go into my report real quickly, I'll highlight some of the items, but not necessarily everything in here, and if you have questions, please let me know. We did complete our state accreditation program review during the last week of October. We had a few more reviewers come in during the final week. We had originally scheduled from October 21st to the 25th. We had a couple people that needed to come the following week. So anyway, we met all the indicators in the process, and I think that staff did a really good job of organizing for the accreditation review. We've never not been an accredited health department. This is the 5th cycle that the state has gone through, and this happens every 3 years. So we're doing a great job, and I think you can expect that in the future. We have completed billing all rejected claims that I described in my report last time from Medicaid billing and commercial insurance, so we no longer have any issue there. It's all been taken care of. Been very busy with health integration activities, both between the health department and with Allegiance Health. Been attending some of their network development seminars and symposiums with their consultant, because it's helpful for me to understand how they're organizing their network so that we can figure out where public health will fit in, as well as other community-based and social services in the future. We have training scheduled from the Jackson Health Network with our staff on December 5th. And then we will be turning around and also training the Jackson Health Network staff in early January on public health services and programs. So I think between those two things, we'll be able to figure out what are the potential services that we can build into linkages in the Jackson Health Clinical Integrated Network, and then from that, which ones should we pursue, which ones will we prioritize, and then we'll move forward based on that. So it's kind of taking a bit longer than maybe all of us would like, but we just have to work through the process and based on schedule availabilities to get there. Also, good news, Dr. Amy Schultz, who also serves as a part-time medical director at the health department as well as for Allegiance Health, did apply for a $35,000 grant from the State Department of Community Health. And its purpose really is to, they're looking for ability of one-time projects to demonstrate an innovative approach to improving the delivery of Michigan's health services. I was able to quickly assist her with reviewing that application, and it was submitted, so we're hoping that we might be selected for developing a test model to help us prepare to engage with the Center for Medicare and Medicaid Services, and also this will help support some formal mechanisms for community input into the network and the HIO. So we're pleased to be able to be part of that. The Ad Hoc Community Health Assessment Committee has had 2 meetings now. In a nutshell, this committee works together. It's composed of health department staff and prevention and community health staff, as well as some other key stakeholders in the community. We will be updating and producing a new assessment report for Jackson County in 2014. The last one that was done was 2011. And then the community action plan from that will be updated and redeveloped as well to reflect what we think the current priorities are. So we're working on that. The HSCA has a Data Action Community Needs Assessment Committee that's working as well, and I've kind of described for you the meetings that have been held there and what some of the key issues that have been identified at this point in time that we want to look at. I think in particular, one of the items that is generating a lot of interest is to perhaps do something a bit more with truancy rates of middle school and high school students, because if children aren't in school, they don't learn, and we know what that results in. So that one we may get a lot of buy-in from the HSC membership in general. We're waiting for, the Carnegie Central Summit was held on October 15th. This is a continuation of what was originally the first meeting that was held in July. But the district library is no longer an option potentially for creating this one-stop shopping place, if you will, for children's services and needs. And so now we're looking at a new approach called the Single Stop Prosperity Center, and it could be co-located with the United Way building on that particular location. So anyway, it's still a work in progress, and people are still talking about it, and we'll see where it goes from there. I think overall, from the Public Health Department perspective, if it's an approach that will result in better and more efficient and effective services for children and families, we would be in support of it. Just figuring out what our role would be is probably where it's at right now. Let's see. Yes, Commissioner Schammel.
As you're looking for space and the district library was not available, have you considered county property? I mean, we have a building here that has space in it. We have other buildings that are available.
If I may address that, I did. I've been attending those meetings, and in reference to this topic, this is the item that I sent you an email recently on, sharing with you the process. And at the very first meeting, when we started to talk about space, I was in contact with Rick Shealy immediately during that meeting, looking at the square footage of both the Woolworth building and other options of county space. So I have been in contact with our facilities department, and I do not believe that we have any buildings that meet the requirement because of the significant square footage they're looking at. I still do not believe it is an adequate amount. Significant amount. They are looking at, if you take the two United Way buildings right now that they own, they are looking at tripling to 4 times that amount of area. They're looking at a lot of options, including the fire station downtown, maybe possibly purchasing that additional ground as well from the city. It's significant. It is a significant square footage. They're working with architects right now to come up with a plan and then look at financing options. Richard, what would you like to add to that?
Well, the only thing I think I would add is that I think we're probably still in the process of figuring out what agencies and entities would locate there. Would they actually become tenants, or would they simply provide service delivery? I think that's all still part of the conversation and discussion. I don't think it's been finalized as far as the estimate of the actual square footage that's needed.
Correct. They still are looking at the other collaborative entities in which they would build this program and model around who all would like to house their services within that building. But just know that the earliest numbers I had, the county has no facilities that would meet that. And they're looking at additional grounds, they're looking at a daycare facility on board, they're looking at green space to collaborate with as well for parks and the children, and it's significant. But I'd be happy to, I sent the email out recently with the updated information, and we'll keep you informed.
I haven't seen one either yet.
They're looking at an auditorium, they're looking at for housing larger venues of meetings. It's all in the brainstorming.
It is, very much.
They're brainstorming, they're gathering information, and as they proceed along. Those are the conversations that are taking place right now, correct. But we know the Felician sisters have been on board. These conversations have been taking place for approximately 2.5 years ago. These conversations started between United Way, the Carnegie, the District Library, United Way, and the Felician sisters, and DHS. Jerome Caldwell's involved with the conversations as well, so they're just gathering the players to the table right now.
A lot of information gathering, a lot of conceptual thinking, not even probably at the strategic planning level yet. It really is a lot of brainstorming. So we'll keep you informed on what we know.
Commissioner Placzek?
I just wanted to ask if you could look at Ellen School and put that in the mix. Okay.
I will definitely forward that on. But the public schools, ISD and the public schools have been involved with the conversations as well. So, but definitely, definitely can.
There's very good cross-sector representation in this group that's been meeting, so. Okay, let me see if there's something else here. Emergency preparedness, I think probably everyone is aware that the county did issue some written procedures a few years ago on emergency procedures for county departments, employees to use for evacuation and response in their workplaces. And we've been taking a more in-depth look at it at the health department, and we're actually working with the rest of our colleagues in the DHS building, or the Human Services building, to rework some of that into a more easy, user-friendly format that can be distributed to all employees. So that's another little project that we have going on. We want to make sure that we work together in a coordinated fashion to organize and conduct fire drills. We really haven't had many in our HSE building over the past few years, and they've kind of gone by the wayside. We want to put them back in place. So that's part of what's driving this. We have had some influenza cases reported in the state now. None so far in Jackson County, but there were one child and 2 adults from southeast Michigan in that particular region that were identified with influenza. And so it is here in the Midwest and certainly in Michigan, and we are continuing to encourage people to get a flu shot, as we do every year. And even county employees can continue to come to the health department during our normal scheduled hours to receive a flu shot, and would encourage the county departments to continue to do that. The early on contract is on your agenda, so I won't go into detail on that one. We did decide to accept a small amount of funding from the Michigan Department of Community Health on lead poisoning prevention program funding. It's primarily for outreach and education-related activities, and we'll be looking for other funding that we can use to support that on a broader scale. We used to do a lot more work in childhood lead poisoning prevention, but CDC pass-through funds were eliminated a few years ago through sequestration and budget cuts, and now we're slowly trying to find a way to rebuild that capacity. Yes.
Commissioner Mahoney?
And I appreciate that comment. I was talking with Don Haydock as we were driving down in the car. I said, we need to connect with the city and with the code enforcement officials. We need to sit down and have a conversation about who's doing what, where. I'm sure that some of the lead assessment, risk assessment work is related to the HUD Section 8 housing program, but we can do more than that as well. But we do want to talk with them. Mm-hmm. Right. Right, yes. And, yeah, and we actually had a display up, I think it's still up in the health department, in the Human Services building in the lower level lobby from Michigan Department of Community Health on access to resources that can be used to help remediate private dwellings as well as public buildings that qualify for that particular purpose. So, yeah, we're gonna be doing some reach out. Thank you for that comment. Our health education and health promotion staff have been getting some training and webinars on how to support the federal health insurance marketplace from Michigan. And we do plan to serve as a certified application counselor, designated organization under that arrangement. And environmental health, we had a new kennel attendant that has been hired for the shelter and start working with us on Monday, October 22nd. So that's pretty much my report, and I'd be happy to answer any questions that you might have.
Commissioners, any other comments or questions for Richard? All right, we'll move on to Agenda F, the contract with Jackson County Intermediate School District for early on services through Great Parent and Great Start funding.
This is a continuation of a contract we've had for a few years to help support our Toy Talkers program, which is connected up with the Early On program for families with children who have needs that are met through the Individuals with Disabilities Education Act. And this comes through us through the intermediate school district, but through the Great Parents Great Start funding. It's probably Head Start funding through the federal sources. So we're really pleased to have this agreement in place again. It continues on services we've been providing for quite a few years, and it's been a very successful evidence-based model that has been well received.
All right, thank you. So I'm looking for a motion to send this to the full board. I have a motion and support. All in favor, say aye. Aye. Opposed? All right, this will be moved on to the full board then.
Thank you very much.
Thank you, Richard.
Have a great day.
And again, welcome, Don. Good to have you here. Next on the agenda, Administrator Controller Resolution for the Medical Care Facility MOE funding. Does anyone have any comments or questions for our administrator? This is this is just part of the process in which we are reallocating the funds to them to pay their own debts.
Yeah, it's an annual.
All right, so I'm looking for a motion to approve this resolution and send it to the full board. In support? And I have a motion in support. Support. All in favor, say aye. Aye. Opposed? All right, thank you. We have the October 1st to October 31st claims that have been passed down. We have a motion in support for the claims to be paid. All in favor, say aye. Aye. Opposed? And they are paid. We have other meeting minutes in your agenda. We have the DHS September 23rd meeting minutes in there included for you. We have December reporting schedule. In December, we will hear from Department on Aging, Health Department, Lifeways, Medical Examiner, DHS, Medical Care Facility, as well as Veterans Affairs. That takes us to our final public comment. Is there anyone that would like to address the board? Any commissioner comments? I move to adjourn.